That you see here in front of you will share 10 minutes of their time with us. Then at the end, we will disperse and you will have the opportunity to chat with them on a one-on-one basis if you would like. I am honored to introduce our spectacular panelists for this evening's event. First up is Gina Mauricio. Gina graduated from the University of Southern California with a Bachelor's of Science degree in Dental Hygiene in 1998. The last 10 years, she has been in a private practice in Chula Vista. I would also like to mention something very special about Gina. She also dedicates many volunteer hours in our community. She has provided dental services to low-income and uninsured families. Please welcome our first panelist, Gina Mauricio.
Thank you. Good evening. So, I am a registered dental hygienist, and the RDH stands for Registered Dental Hygienist. And BS is a Bachelor's of Science. I normally wouldn't put that in, but the reason why I did is because to be a dental hygienist, you can either go through a community college program and earn an associate's degree, or you can go to a bachelor's degree program like I did. And I went to the University of Southern California, and there are 315 dental hygiene programs in the United States. I chose the University of Southern California because as a native San Diegan, I wanted to be close to home. I actually came home every single weekend. And the difference between an associate's degree and a bachelor's degree in dental hygiene is the amount of science classes that you take. Whether you go to an associate's program or a bachelor's program, you're going to take the similar dental hygiene prerequisites, which are anatomy, physiology, microbiology, chemistry, nutrition, communications, psychology, sociology, and reading and composition. In the bachelor's degree program, you have to take some upper division science classes with the dental students, so essentially you're taking graduate school classes, and those are oral biochemistry, head and neck anatomy, histology, microbiology, immunology, and medical pathology. That is a lot of science. Now, I was not at all interested in science in high school. I did not have one of those brains. Some people have science brains and math brains, but I just knew that I wanted to work with people. I knew I didn't want to sit at a desk all day, and I knew I wanted to wear comfy shoes to work every day. So I thought dental hygiene would be a good option for me, and I got through the barriers of not being a real science person by just hard work. So this is my desk. Somebody's out there. And I am the person, I'm sorry, if you don't know what a dental hygienist is, it's the person that cleans your teeth when you go to the dentist and questions you on your flossing and how often you brush your teeth. And I'm sure you all floss every day and brush twice a day, right? Yeah, I thought so. So when the patients come in, first thing I do is review their medical histories, and I go over any new diagnosis that they have for their systemic health. I go over any new prescriptions they have. A lot of prescription medications create a dry mouth environment, which makes you more susceptible to oral disease. I go over if they've had any current surgeries, because some surgeries require you to postpone dental care for a little while, and as well as go over blood pressure screenings. Then I take x-rays, I clean their teeth, I do a periodontal screening to see if their gums are in good health or if they have periodontal disease, which is bone loss. I give them patient education on how they can make their mouth healthier, toothbrushing instructions, flossing instructions. I also have a license to deliver dental anesthesia. Sometimes I have to numb up my patients if they have a gum infection and they need deeper cleanings. I also will numb up patients for the dentist if he's running behind schedule. So over here, we have a picture of gingivitis. This is the first stage of periodontal disease, and it is an inflammatory disease. And what a lot of people don't realize is that there are lots of other inflammatory diseases that if you have periodontal disease, they affect it, and it affects periodontal disease. They're all related by inflammation. So that's what makes me a healthcare provider, because I treat the whole patient. I'm educating the whole patient. I'm not just cleaning their teeth. So you can see diabetes, cardiovascular disease, osteoporosis, respiratory diseases, rheumatoid arthritis. Somebody with rheumatoid arthritis has a 50% chance that they're going to also have cardiovascular disease. They're all related. So what's the salary of a dental hygienist? It varies throughout the country. California, luckily, is the highest paid state. Typically, a dental hygienist, if they work 4 days, that's considered full-time. But so I just put an approximation in here of 3 to 5 days. So if somebody works 3 days, they're going to make just under $60,000. If they work 5 days, which is rare, close to $100,000. It comes down to about $19,000 for every day you work per week. So what I dislike most about my job is that people think that I'm just there to polish their teeth. They don't realize the knowledge that I have in the whole body and their whole health. And oftentimes I've heard, you went to college for this? So yes, I went to college for this, and I am a healthcare provider. So I'm glad to have this opportunity to come and speak to you guys and let you know that. So that, you know, it's a good career. It's a good career if you only want to work 3 days a week and do 2 days of something that you absolutely love. What I love is working in a family practice. I really get to know people, generations of family. I have 4 generations of family, several families like that. And I get to watch kids grow up, graduate from high school, get married, have children, and I just feel like I'm a part of their lives. I really like that. So I want to make sure that you guys understand that your oral health is connected to your systemic health. So I want to make sure that you are flossing daily and brushing twice a day for 2 minutes. This is me cleaning a denture. And so this is where you'll be at if we do not floss your teeth daily and brush twice a day. I'm happy about it because I'm going to be done in 2 minutes and on my coffee break, okay? But I don't want you guys to be in that situation. So that is what a dental hygienist is, and this is the day in the life of a dental hygienist. Thank you.
Thank you very much. Gosh, makes you want to just like brush your teeth. All right, next up, Josh Telsey. He was born in Long Island, New York, and he has an impressive list of schools and internships. He received a Doctor of Physical Therapy degree from the University of Minnesota and later became a certified orthopedic manual therapist. Please welcome Josh Telsey.
Thank you and good evening. So as Eddie had said, my name is Josh Telsey. I am originally from Great Neck, Long Island, New York. I went to Great Neck High School, and there I actually did like all the science and math classes as well as Spanish and photography. My least liked classes in high school were definitely English and social studies, which is probably why I got into the profession I'm in now, which is physical therapy. After high school, I originally went to Michigan State University for undergrad, but transferred out after just 1 semester feeling that I really didn't reach the maturity level enough for me to be away from home. So I transferred back to New York to Hofstra University, where I got a business management degree. So a lot of you are probably thinking, well, how did he go from business management into the medical field? Well, I did business management for a couple of years working in the local school district in their payroll department. And I got really, really sick and tired of just sitting at a desk for 8 hours a day pushing paper, answering phones and going through the same monotony every day. So I looked into making a change, and I really enjoyed sports all through my life, and decided at that time that I was going to make a change into sports management. So there I went and I worked for an ice rink in New York for about a year, then went on to get a master's in sports management at the University of Minnesota, where then I worked for men's athletics at the University of Minnesota for a couple of years. Well, that entailed long evenings and weekends, and I kind of wanted to start a family and get out and hang out with my friends on weekends and stuff and not be locked in to being in an arena all weekend long. So that's when I decided to look into physical therapy. So I ended up going for my doctor of physical therapy at the University of Minnesota, which was a 3-year program. In the 3rd year of physical therapy programs, just like in medical school, the students go out and do rotations, where they spend up to 8-12 weeks at a clinic or in a hospital, working side by side with trained physical therapists, learning more hands-on experience. Well, my second to last experience happened to be here in Southern California, in San Diego, when I was offered a position upon graduation. And if anybody has ever grown up or even been to a Minnesota winter, you want out pretty quick. It's very cold, so I said, sure, let's go. So I am now on my 11th year here in Southern California. I currently work for Proactive Physical Therapy, which is right here in Carlsbad off Palomar Airport Road. So some of the things that you will need if you do want to follow a career in physical therapy is you will need a 4-year undergraduate degree followed by a 3-year program for a doctor of physical therapy. It was around the year 2000 when the Physical Therapy Association of America decided that by the year 2020 they wanted all physical therapists to get a doctoral degree, up from a master's level degree. And I would say currently in 2014, right now, I would say about 80% of universities are now offering the doctoral degree, with about 20% still offering a master's. And within the next 5-6 years, it will be 100% a doctoral degree. So one of the questions that was asked that they wanted us to hit upon is what type of training do you need if you want to go into possibly physical therapy? Well, other than your undergrad degree, it's very important that you get volunteer hours. So if anybody here is interested in possibly following a career in physical therapy, you definitely should look into your local hospitals, contact your local physical therapy clinics, and just offer your services as a volunteer. Okay? I do want to make a very important comment regarding volunteering. Most universities do look for volunteers that take the initiative to go into a hospital setting where there's sicker people. If all you do is volunteer at an outpatient orthopedic clinic, which is basically working with your weekend athletes, they kind of frown upon that. They actually want to see you kind of get your hands on people who are bedridden, who are using wheelchairs, who are using crutches to get around, people who can't move very well, people who are in severe amounts of pain, to really see if it's the career for you. So if you are truly thinking of going into physical therapy and you do volunteer work, don't forget, look into those hospital settings for your volunteer work. As far as the coursework needed to get into physical therapy schools, you do need 1 year of biology, you will need 1 full year of chemistry, 1 year of physics, and then in addition you will need 1 year of anatomy, 1 year of physiology. Most physical therapy schools will also require that you take a statistics class, and some will even require organic chemistry. So if anybody here knows anything about organic chemistry, they have an older brother or a sister, or a mother or dad who's ever gone through it, you might want to look for a university that doesn't require it. Why did I choose the profession of physical therapy? Well, I've always had an interest in working with athletes and in sports. And after working in sports management, I kind of decided I wanted to work more hands-on with these people and return them to the activities in the sports that they so love to be involved with. So that is really how I decided on going into the physical therapy route. And also, as I had stated earlier, not just sitting at a desk all day. In fact, if I'm sitting at my desk for 15 minutes in an 8-hour day, that would be a lot of desk time. Okay, the majority of my day is standing, working with patients. There's a lot of hands-on work. It definitely is a workout, If you get a 6'6" guy who weighs 300 pounds and he's coming to you with hip pain, that leg gets very heavy after a while. So that is another thing to consider if you're going into this profession. Now, one thing to be aware of is that there's many facets of physical therapy. A lot of people, when they hear physical therapy, they immediately think of sports and rehabilitation after surgeries. Well, a lot of you might not know that there is a whole branch of physical therapy that just focuses on neurological disorders, or working with people after they've had strokes or heart attacks. There's geriatric physical therapy, working just with geriatric patients. There's pediatric physical therapy, that's working from a neonatal all the way up to maybe 4 or 5-year-olds with issues. Most of the time, those are birth defects, learning disorders, or developmental disorders. The profession for physical therapy, I think, is in great demand and is only going to get in higher demand with our aging population. As medicine and technology keeps improving and keeping us healthier for longer periods of time, and out of being sick, we're living to longer and longer lengths, and people are having just regular aging issues of degeneration, arthritis and stuff that they always need help with. As far as salary range goes with our profession, it's very similar to other professions depending on your location in this country. Southern California does probably pay one of the highest salaries to physical therapists in the country. Just to give you an idea of the difference in salaries, now this is based on about 10, 11 years ago after I graduated from school. If I had stayed in Minnesota and worked as a brand new physical therapist, the starting salary would have been about $57,000. Coming to California, the starting salary is more in line about $65,000 to $67,000. And the average salary for an orthopedic outpatient physical therapist after about 10 or 11 years is probably in the $80,000 to $90,000 range. If you're looking to make more money than that, believe it or not, working with the geriatric population in nursing homes, in hospital settings, will actually up your salary by about $10,000 to $15,000 a year. And the reason for that is just because the demand for those physical therapists is high, but not very many physical therapists like to work in that type of an environment in a setting. Just because they're working with much sicker people, and it can get a little bit depressing after a while, okay? So the big thing is most physical therapists like to work in an orthopedic outpatient with the athletes, not with the sicker people. So just keep that in mind. If you do work in those hospital settings, you know, it's greatly needed, and people will be very happy that you do that. People are always asking me what's the best part of my job, and what is the normal day of a physical therapist like. I tell them there is no normal day of a physical therapist. Monday I can come in and I can have a post-op patient that just had a huge knee surgery. The next morning I might come in and work with an elderly woman who just fell, bruised her hip, and just needs to kind of learn to walk again. And just real quick to wrap up here, just so you know what I like least about my job, that would be more the paperwork, the charting, and dealing with the insurance companies. Okay? So I do think physical therapy is a great profession for people to think about. And again, there's loads of facets to the profession, and definitely look into it. If you have any questions, I'll be available afterwards. Thank you very much.
Thank you. Everyone in my family have been treated by Josh, except me. Proud to say. All right, next up, Sean Canfield. He's our local guest. He attended Hope Elementary, Valley Middle, and graduated Carlsbad High, but we'll still let him talk here. Sean was drafted in the 2010 NFL draft by New Orleans Saints as a quarterback, where he played for 2 seasons. He is now going to tell us his story, how he is now becoming a paramedic and firefighter. Give it up for Sean Canfield.
Thank you. So, as stated, my name is Sean, I'm 27. I'm recently married. My wife is here tonight, sitting right there in the pink. Everyone say hi to Jen. Eddie happens to be neighbors with my mother-in-law, so he reached out to me about a month ago. Found out that I was going to become a paramedic firefighter. And so I'm basically here tonight. I want to kind of go over the outline of how you get to becoming a firefighter paramedic. It seems to be kind of a muddled understanding. Like, you see a fire truck, who's a paramedic, who's a firefighter. So that's kind of the goal of tonight, and obviously the questioning and answering portion will be really helpful, just with all the details of the career. First, I'll start out with myself. I went to Hope Elementary. I went to Valley Junior High. 2 brothers, I'm the middle. I have 4 parents. My parents divorced at the age of 7, so 2 step parents, great support system. Went to Carlsbad High, played 4 years of football there. Pretty much since I was 10 years old, I wanted to be a pro football player. I wanted to play in the NFL, which I started at the age of 9 and then worked my way up. I received a full athletic scholarship to Oregon State, and I know you from Carlsbad. Sorry. 4 years at Carlsbad High, started there as a sophomore and then accepted a 4X scholarship. Played 5 years at Oregon State. I redshirted as a freshman. If no one knows what redshirting is, it's essentially, as a football player, it takes time to get obviously bigger physically and understand the playbook. So you kind of sit out a year, you practice with the team, but you don't play. So you essentially save that first year of your eligibility. So that's why I was there for 5 years. And then as far as a major course of study, I was undecided for 2 years. And then I took a course from a woman named Lonnie Roberts, who my wife knows. And ever since that course, I decided to study philosophy, which was like football and philosophy. I don't know, but I loved it. And then I got a BS, Bachelor of Science, in philosophy. And then I accepted I didn't accept, I got drafted in the 2010 NFL draft. Pretty much accomplished what I wanted ever since what I wanted to do since I was 10, as I said. So that was a big day. I was picked 239, that high. So that was exciting. So now you're wondering how I got into emergency medical services, or EMS. And hearing the first 2 speakers, I'm talking about a neonate. What's a neonate? A neonate is anyone from 0 to 28 days old, in case you're wondering. But a lot of correlation between what you two were talking about. I came home after the 2012 preseason. I started and played against the Tennessee Titans. We lost. I was released the next day. And I think it was a week later, I found myself in a movie theater in La Jolla. My wife was supposed to be there. She couldn't make it. She had work. And I essentially had a panic attack in the movie theater. I didn't know what I was going to do with the rest of my life. I played football since I was 10 years old. And my wife had always kind of been putting into my ear, hey, what about being a firefighter? What about being a firefighter? I was like, what are you talking about? And we actually have a friend named Paul Verkar, who is a firefighter, paramedic for Carlsbad Fire Department. So I decided to kind of give it a go and just see what the whole career was all about. So I went on a ride-along with Paul. A ride-along is essentially you show up at the fire station and you just kind of shadow whoever you're with that day for as many hours as you need. I think I stayed from 8 to 5. And it was since that day, I think it was 2 years ago, right around this time, it was fall, went on a ride-along, and ever since that day, I sat in the fire station with Paul and mapped out essentially the steps to becoming a firefighter paramedic. So pretty much since then, I have been doing this the whole time. So my name tag says fireman paramedic. At this time, I have no fire experience, so now I'm going to get into kind of the detail of the two different fields. So you see, most San Diego firefighters are paramedics at the same time. There are firefighters only, and there are just paramedics. But before you get to that, you have to, the only prerequisite is you're 18, and that you have a driver's license. But first, you got to go to EMT school. So EMT stands for Emergency Medical Technician. And basically what they provide is BLS, basic life support. So it's kind of the grunt work you have to put in before you get into paramedic school. So EMT school, there's a few schools around. I went to EMSTA, which is in Santee. Palomar College offers a program, which is really, really good. Miramar College offers an EMT program. I did an accelerated deal at EMSTA out in Santee. It was 8 weeks. And basically it was brand new for me. I knew nothing about the career. The only experience I had was talking with my friend Paul at Carlsbad Fire and that ride-along that I went on. So learning paramedicine and anything with medical type thing was just totally new to me. I did have my philosophy kind of background, so studying obviously was very helpful. So it was an 8-week course, and then once you're certified as an EMT, you get your state and county license, and then you have to work for 6 months to a year as an EMT on a BLS ambulance. So BLS, again, meaning basic life support. So what does it consist of working as an EMT? Essentially what you're doing is taking stable patients from hospital to hospital, whether it's an insurance reason. An emergency patient comes into Palomar Hospital, which is a level 1 trauma center, and then a week later they've had an operation, they're stable. You might come take them from Palomar Hospital to Kaiser Hospital because they have Kaiser insurance. You might take someone from an urgent care to an ER who isn't very, very critical. Any critical patient, paramedics are going to show up on scene. Paramedics are obviously a higher level of care than EMTs provide. So 6 months to a year working as an EMT, and then you can, in that time, I think what I did is the 2 prerequisites you need for paramedic school. You have to be an EMT, as I said. 6 months to a year work as an EMT. You have to take anatomy and physiology, a very basic anatomy and physiology course. There's one at Palomar, which is one I took. And then you have to take paramedic prep. Paramedic prep is provided at Palomar. So I am just now finishing up paramedic school. And it's Palomar College in Escondido is where I did my paramedic school. So once you have your EMT license, your work experience, and your anatomy and physiology, paramedic prep, you can apply to get into paramedic school. There's an interview. It's very much a paramilitary type academy. You shave every day, like today, and you have to tuck in your shirt. You have a full uniform every day. Paramedic school is pretty demanding. My wife can attest to that. All the late night studying and my cranky moods. So essentially, it's a year long, 10 months to a year. I'm right now on the tail end of finishing paramedic school. It is, I think the schedule is 4 to 5 days a week, 8 to 5. It's pretty much consistent throughout, 8 to 5 p.m. Pretty demanding. I got married right in the middle of it, so that was fun. That was stressful. And then there's pretty much 3 parts to paramedic school. There's your class portion, or didactic is what they say. You do all your simulations, you learn all the medications that you were able to administer as a paramedic. I think there's 21 meds. You do like mega codes, what I have to do one tomorrow for actually my final exit interview. So the didactic portion is roughly 6 months. The next phase is your clinical internship, which is 2 months in a hospital. You'll kind of visit all the different branches of the hospital. You'll spend a certain amount of time in the ER, you go to the OR, operating room, you go to the cardiac cath lab, telemetry, and that's 2 months. And then your last portion is your field internship, which is basically you're an intern at a fire department or working aside a private paramedic in San Diego, Chula Vista, or wherever you get placed, because it is very competitive. And you're pretty much the one running the call. So if someone obviously has some type of issue, they're not breathing, cardiac arrest, shock, whatever, you're essentially there to learn from the paramedic who is your preceptor, who basically watches over you, and you're essentially the one running the call. So your field internship is roughly 2 months. You have to do 22 24-hour shifts. And that, for a lot of people, is really probably the most stressful part of paramedic school, because you're not in the class learning and doing fake simulations. You're out there treating people with real issues and real problems. So I just finished mine. It was at Oceanside Fire Department, Station 1. Had a great crew, and as I said, tomorrow I have an exit interview, which is going to consist of a mega code. It's a simulation type thing and a written test. So those are the kind of components of becoming a paramedic. As I said earlier, you can just be a firefighter in San Diego, although if you do have your paramedic cert, you're much more marketable. Most, as I said earlier, most firefighters you see around North County and San Diego County are all paramedics. The captain, the engineer, at one time they've all gone through paramedic school. There are still a few that are just firefighters, but as I said, you are much more marketable being a paramedic because that's essentially all the call volume. 80% of the calls, or even 90% of the calls, are medical aids or trauma calls. Fighting fire is obviously another aspect of it, and I am applying. I actually applied last week for Fire Academy, which just starts in January. So that's kind of where I'm at right now. Parts of the job that I love, there's a lot of carryover from what I did before. You know, you have to obviously be personable. You show up in someone's private residence and you're taking care of their family. Leadership skills are obviously very, very helpful. You work 10 days a month as a firefighter, so that's not bad, although they are 24-hour shifts. That seems to be obviously the biggest perk of the job is just working 10 days a month. The sleep deprivation is probably the biggest downfall, talking to my crew in Oceanside and just being around the field for the last 2 years. You get woken up at any time of the night, essentially. So on my internship, we had a ton of wake-ups, 3, 4 in the morning, come back to bed, have another one 15 minutes later. So that is definitely probably the biggest con, I guess. And then once you're a paramedic, getting paramedic school over with is the biggest and probably hardest part because it's longer than the Fire Academy. I applied, as I said, for January 12th start date of the next Fire Academy, which is at Palomar College, where they run a great program. And that's only 4 months, 5 days a week, pretty much from 5 a.m. to 5 p.m. And it is very paramilitary, even more so than paramedic school. But getting your medic cert is obviously a huge, it's like the golden ticket to getting hired on in the fire department. It's the hard part, it's the learning and studying, the late nights, learning all the different medications verbatim, you know, the actions of the drugs, the side effects, yada, yada, yada. So right now, I'm kind of just getting into the firefighter side of things. And I think, as I said earlier, the question and answer part of this evening will be very helpful. So that's where I'm at.
Thank you very much, Sean. All right, next up is Captain Tom Nelson, MD, FACS. He'll explain that. Naval Trauma Surgeon. Captain Nelson is the department head of general surgery at the Naval Hospital Camp Pendleton. Captain Nelson takes care of our servicemen. What an honorable profession. He has served in a variety of clinical posts and leadership positions during his 19-year career. Please welcome Captain Nelson.
It's nice to be here tonight. Actually, one of the things that's, I think, great about everybody who's up here, one of the things beyond what we do in our careers in terms of making money and doing something that's stimulating is we do stuff where we take care of people. And I think that's one of the neat things about, particularly I felt with being in the medical profession. Being in the medical profession is that you have the opportunity not only to do something that's interesting, but also to take care of people. So at the end of the day, at least you feel like you've done something that's added to someone else's life. To become a physician, obviously people have to go to college. Generally they're going to end up with a 4-year degree. You need to get pretty good grades. And then you also need to go to medical school after that. And after medical school, for general surgery, typically people do between 5 to 7 years of residency training. Those are long hours. You spend a lot of time in the hospital, a lot of study involved with all those aspects. But in general, usually most people would do 5 years of residency training unless they do a couple years of research. And then a fair number of people will also go on and do fellowship training. I did fellowship training at Scripps Clinic in minimally invasive surgery where we used a laparoscope. So salary in the Navy, these are Navy numbers, so it's probably a little bit less than what people would make as a general surgeon in the community. You'd be anywhere probably from about $118,000, and that would be right out of training in the Navy, where you're getting sort of some basic special pay for being a general surgeon, up to potentially up to $300,000 a year, and that would be subject to the fact that maybe you are needed, you have an area of expertise that the Navy values. And then also, if you've been in the Navy for a long period of time, some of your salary is going to be based on the years of service that you've done. The other thing that I would say too, not only about the money that you make while you're functioning as a surgeon in the Navy, is that most people coming out of medical school right now, for just medical school alone, not even their college debt, are going to be anywhere from $207,000 in debt in a public school to potentially close to $300,000 a year, $300,000 of debt in the setting of if they're going to a private school. So it's a lot of money. That doesn't even include some of the other things just in terms of living and books and things like that. And the way that I actually got into the Navy was I was thinking, how in the world am I going to pay for school? And I decided, wait a second, I can sign up for a scholarship that will pay for all my tuition, which at the time, this was quite a while ago, this is 1991, and the tuition was about $40,000 a year. It also gave me money to live on each month so I could pay my rent, and they paid for my books, and ended up being a pretty good way to finance medical school. And I didn't really think that I was going to plan to stay in the Navy for 19 or 20 years or longer, but it's been kind of an interesting ride. So a typical day, I think for a lot of us, there's no such thing as a typical day. Things change, and I would say that when I'm here at the hospital, at Naval Hospital Camp Pendleton, or I practice down at the Naval Medical Center in San Diego, there would be days where I'd be in clinic, where I'd see patients that might come in and have problems with their gallbladder, or they might have a hernia that needs to get fixed, or they might have a colon cancer, or a breast cancer, or thyroid cancer. And those would be days where generally the whole day would be spent seeing patients in office, just like maybe when you go see your doctor, although we would usually be dealing with surgical disease and things that need to be removed, fixed, or cut out. And then days where I'd be in the operating room. And as a general surgeon, a lot of the operations that I would do would be stuffed inside your abdominal cavity, taking out people's gallbladders if that's sick, taking out your appendix if you get appendicitis, fixing hernias, removing colon cancers, breast cancer, in general stuff that's inside the abdominal cavity. And subsets of general surgeons will do additional training in cardiac surgery and thoracic surgery where they would operate in the chest and operate on the heart. And then there'd be other surgeons who would work on urologic organs or gynecologic organs in terms of women reproductive tract and whatnot. But the other thing about the Navy that's kind of interesting is that you get an opportunity to go all around the world. Unfortunately, a lot of the places you go aren't always the nicest places to go. I've had the opportunity to float halfway around the world to the Persian Gulf and back over a 6-month deployment. I've served on a carrier. I've had the opportunity to go to Iraq and the Horn of Africa, and then also to Afghanistan. But also seen some fun places too. Visited Australia, Bali, Indonesia, the Marianas, been a number of places around the world. My first job as a surgeon after I finished my training was actually on the USS John C. Stennis, which is a nuclear-powered aircraft carrier. There's one surgeon assigned to those ships, so that gave me an opportunity to see flight deck operations at sea, which is pretty interesting to watch them launching and recovering aircraft. It's a pretty interesting area, and probably the reason why they put a general surgeon out there is that it's a very heavy industrial environment, which leads for an opportunity for people to become seriously injured. And that's one of the main reasons you're out there. And then I also for a while covered the Abraham Lincoln when they were in the Persian Gulf and had an opportunity to fly out there and support them when their surgeon was on emergency leave. I also had the opportunity in 2004 to go to Iraq. I was at that place where it says convoy attack, a place called Al-Qaim, very close to the Syrian border where you see a lot of stuff going on right now with ISIS. And had the opportunity to support the Marine Corps and was functioned as a trauma surgeon there. Unfortunately, a lot of the injuries we saw were very, very bad injuries from roadside bombs. A lot of really, really devastating injuries. A lot of young Marines lost limbs in their lives. But it was a really rewarding experience to have the opportunity to take care of those people. But kind of an austere and sort of unfriendly environment to be in. This is just a picture of our surgical team when we were in Iraq, wearing our Marine uniforms. The Navy supplies the Marines with all their health care. And just a picture of operating there in our field hospital. I also had the opportunity in 2009 to go to Djibouti. Actually, it was 2008. Djibouti, there actually is a country called Djibouti. But it's just north of Somalia, in the Horn of Africa. And it's real close to Ethiopia. And there's a lot of interest there because of the pirate operations out of Somalia. I don't know if any of you saw that movie, Captain Phillips. But there's a lot of U.S. military presence there. And also too, because Yemen is kind of a big terrorist country that's right across the water. We both have Aden there on the map, but had an opportunity to work there, and that was kind of fun. Got a chance to operate with a Djiboutian surgeon in a city hospital, and did a lot of surgeries with him, and then also worked with French Army physicians, which was a pretty interesting experience that I didn't really ever expect to have the opportunity to do in the Navy. And also when I was there, I got a chance to go down and climb Mount Kilimanjaro. And actually the lowest point in Africa is a place called Lake Assal. So I got a chance to go to both the lowest and highest place on the African continent. I think the only continent that I haven't been to with the Navy is South America, because we had the opportunity to visit Australia on one of my deployments. And then in 2011, I went to Afghanistan and was down sort of in the southern part of that map there where the Helmand River is. I was with the Marines once again. And I was with their outfit that was from Camp Lejeune, it's on the East Coast. And we were delivering trauma care for Marines that were supporting coalition forces acting in Afghanistan. And that was a pretty, again, a rewarding experience. This is just a picture of how elaborate our hospital was. Basically, these were tents and some plywood. This is just a picture of the operating room. So, kind of homemade furniture and sort of portable equipment for a surgery suite that could be moved at fairly quick notice, depending where it might need to go. And this is just a picture of a resectance of valve from someone who had been injured from a roadside bomb. So I think the great thing about, again, in general, being a surgeon and a physician is that you get it each day, you do things for other people. So at the end of the day, it's challenging work, but you get to feel good because you help people. And then I also think that one of the nice things about being in the Navy is it allows me to take care of people that serve me and they serve you, and they go out in harm's way to do what our government bids them to do. And it kind of makes you feel doubly good about what you do. And I've had the opportunity to take care of World War II veterans that served at Guadalcanal. I've had the opportunity to serve people who've served in Vietnam, Korea, and both in Iraq and Afghanistan. And that's been a real rewarding experience for me in my life. And that's probably one of the main reasons why I've stayed in the Navy, because it really gave me the opportunity to take care of what I think is one of the most gracious and deserving populations of patients that you can take care of. The other thing too is that you get a chance to see a lot of stuff. Not everyone gets to go out on an aircraft carrier or a submarine or on a ship. And you get to see some places in the world where most people don't ever get an opportunity to visit. I wouldn't necessarily recommend going to Afghanistan right now or Iraq, but it definitely is interesting to meet people from different countries. Africa was a really, really neat highlight for me to have the opportunity to see that and see parts of Kenya when I was there, see giraffes and zebras on the side of the road, and I probably would have never gone to Africa had I not been with the Navy. I never thought in the Navy that I would go to Africa because, again, I was pretty much landlocked when I was there. And I think that the other thing about the job too is that it gives you a good opportunity for retirement. If you do stay in for 20 years, it has great retirement benefits. And for me, it was an excellent way to pay for school. I don't think I would have wanted to try to figure out how I would pay $200,000 or $300,000 of debt back from school. And then the other thing was I got excellent training. And I think that even post-Navy, there's great opportunities. So I had the opportunity because of the exposure that I've had delivering trauma care in Iraq and Afghanistan, that people back here in the United States that are leaders in trauma surgery are interested in our experiences because of the type of injuries that we saw when we were there. They're terrible injuries, and unfortunately, the only things that probably is good, the only good thing that comes out of war is that it advances our ability to take care of trauma patients. So that was a pretty excellent experience to be able to do that. So anyway, come talk to me if you have any questions. Thank you.
Thank you. All right, next we have Parrott is a clinical laboratory scientist, medical technologist. That's a mouthful. 26 years in her profession, Karen has quite a few accomplishments to share with us tonight. Frances Parrott, freshman here at Sage Creek, is definitely proud of her mother. Without further ado, Karen Parrott.
Hello, thank you for being here. I'm a medical technologist, and in the state of California, we're also called clinical laboratory scientists. And I put medical technologist on the slide deck because if you're looking for colleges outside of California, you'll be listed originally came from central Indiana, from Kokomo, Indiana, and I took all the biology and all the chemistry that I could get my hands on at a small rural school in Kokomo. And then I went on to do 4 years at Purdue, and you can be a medical technologist by doing either a 4+1, where you go to 4 years of college, undergrad, the first 4 years, and then your 5th year is in a rotation in a hospital. I did a 3+1, where I went through 3 years, and when I went to graduate, I got an empty diploma, and I had to go 3 more months at the hospital where I was doing my 12-month rotation. We went and we had classwork the first 6 months in the blood bank. We had chemistry, microbiology, and hematology and oncology, which I really loved and ended up specializing in. You have to earn very high grades when you're in medical technology school. It's likened to the first year of medical school, although I don't think the hours are quite as bad. But you are working in the hospital with patients and being supervised by doctors and other medical technologists. You have to earn A's or B's and get really high exam scores to be able to go on to even sit for your tests. And the reason being is that if you give incorrect lab results out and don't understand the science, or you miscall a cell, you can kill someone fairly easily. So you have to really pay a lot of attention to detail and communicate well as a medical technologist. So in Orange County, California, which is where we are, the CLSs make about $32 an hour starting. That's for CLS 1. As you increase your years here in California, you can earn a lot more money, up into 6 figures because of overtime. If you go into LA, you can make even more. But if you go down south into San Diego, you make a little less. The state requirements, be sure if you're getting your degree here in California and you want to move to, say, the state of Texas or Pennsylvania, that you double check the state requirements, because there are different requirements in different states. The first test that I took after I finished my 12 months of coursework in the 4th year was the MT-ASCP. That's a board exam that covers all of the United States. But to work in California, you have to pass the California exam. Also, I work with a fair amount of research scientists that got their 4-year degree or even their master's degree in molecular biology. But in the state of California, there's a lot of rules and regulations, and you cannot do patient results unless you have a California license. So I strongly recommend, if you're going to stay here in California, to go ahead and get your California license to practice laboratory medicine. So I've listed a few links to go at both California and ASCP. And so you can take a look at that, and they have good career pages on the ASCP. So you can take a look at classwork and things like that. Go on to my next slide here. Oh, here we go, yes. Okay. There's a lot of opportunities to work in a lot of different fields. You don't have to work in the hospital. I started out working at a large trauma hospital in Indianapolis, Indiana, Methodist Hospital. I started out in working night shift, and there's no better place to learn how to repair a CBC instrument, a blood count instrument, so you can provide blood to the people who are in trauma and they're bleeding. And there's no better way to learn how to repair instruments and communicate with surgeons and nurses. It was a great start. You can also move on after that to reference laboratories. Currently, right now, I work at a large reference laboratory in Quest Diagnostics in San Juan Capistrano, California. And there's about 1,400 people up there. About 500 of them are registered CLSs, and we work with a lot of support people too. You can also work in outpatient service centers and cancer centers. You can work for pharma or medical device companies. They all need to hire licensed people at one time or another to do their license work. Also, food science hires microbiologists in this state and all over the U.S. Environmental science is very, very big. You can combine the two disciplines. And of course, military, all the we reservists that I work with at Quest have been called up into active duty. There's a lot of medical technologists and clinical laboratory scientists that are retiring, and as they do, they need that specialty. So everyone who's a reservist has gotten called into active duty. Sometimes they're in active duty here in the U.S., and sometimes they're abroad in many different countries and many different situations, many of them in Afghanistan. They all come back with very interesting stories. So it's not just one hospital, we work many different places. Here's some, going the wrong way again. Here, it's really hard to read, but I have any specialty that you might think of as far as being a medical technologist. You don't have to be a generalist and do everything. You can focus down. A typical day for me in the hospital would have been to clock in, talk to the shift that's coming off shift, so to make sure that we're covering anything that's going on in the emergency room. Communication is huge with all of the medical professionals that I work with. We would set up controls on our instruments and do any sort of calibration that we might need to do if we were starting to run batches of blood work through, say a CBC, and we haven't run controls every 8 hours. We could give out results that are not good. So I would evaluate those. I might take a look at the microscope work that I had to do for that day. I might also look at the surgery schedule to anticipate what kinds of surgeries are going on. If there's a liver transplant that day, that means it's going to be very hard to get to lunch. And I might make a deal with my coworker to cover me. We can't just leave because it's lunchtime. We have to find someone to cover the results. I also might check the bone marrow aspiration schedule with a hematology oncologist. I would go out and assist them. We might have 4 or 5 in a row, and it's very important to be very detail-oriented. If you mislabel something, that could cause harm to a patient. When I got back, I would hand off bone marrow biopsies to the anatomic pathology lab. I would also get blood smears to the pathologist because they need to take a look at it very quickly. I might take a sample into one of my coworkers in the flow cytometry lab. During the day, they would do the testing, and by the end of the day before we left, we could work with the pathologist and say, well, we've looked at the cells under the microscope. We've gated the area of where the leukemia cells are. Oh, and here's another cell population that's very interesting to us. So we would then work with the pathologist who would work with the oncologist. So by the time we went home that afternoon, they could get critical medicine to the people with leukemia, and that there's no delays. We would have to work night shift. We might have to work during a snowstorm in Indianapolis. We might have to work during the Indianapolis 500. We got a great lesson in being very HIPAA, meaning that we can't talk about patients outside the lab. If you have all the UNSERs or all the Andrettis coming into the hospital, we learned a great lesson about not talking to the press. So you do learn to keep people's private information private. If you don't, you'll be out the door and out of a career. So the great things is that I know I make a difference in people's lives. While I was at Scripps, I discovered a variant on rare childhood disease that had never been seen before. The doctor, who's the world's leading expert, came to me and told me I did a test wrong. I said, no, I'm sorry, I did not. They had a confirmatory test on molecular genetics, and 3 weeks later, the doctor called and apologized to me because what I had really found was a variant on, it was a child who was been misdiagnosed with a test that wasn't as sensitive or specific, and the test that I helped develop was, and it saved his life. And so he congratulated me and apologized for telling me that I had done shoddy work. But you do have to hold your own ground, but it's okay to ask questions and to learn from one another, things like that. Also, we might be teaching students during the day. It might be pathologists in training, residents or interns. We also might be training new medical technologists or associates. And so a fair amount of my time when I was at the bench was spent training either new employees or any sort of student. So anyway, that's my presentation, and thank you very much for your time.
Thank you very much. All right, and last but certainly not least, Tamara is a clinical pharmacist. She has 26 years of history working beside nurses and doctors in a hospital environment. She is working at San Diego VA Medical Center for the past 16 years. Please welcome University of Washington graduate, Tamara Ogg.
Okay, I'll be brief. First of all, I'm very excited. I'm very excited to be in this facility. I was involved with PTA when my kids were at Pacific Rim and Aviara Middle, and we worked really hard to pass the school bond to build this, so I'm just excited to be here. Oh my gosh. I get emotional. Okay, I kind of want to talk to you guys, and I know you're young, you're just freshmen and sophomores, because I just got my 2 kids through the whole college process. They're both in college, hopefully doing well, and I know how daunting the whole thing can be on where to go to school and what classes to take and how many APs to take and which college you choose. So that's kind of been my focus the last 3 or 4 years. So I'm going to talk a little bit about that. I'll answer a couple of questions too that they wanted me to talk to you about. Like, my favorite class in high school was biology. So I knew that I liked the sciences. I'm glad that this school is a STEM-focused facility for you guys, because the country definitely needs more graduates in the careers of science. So I took my chemistry and I took my physics. I liked physics less than I liked chemistry. I wouldn't say I really liked chemistry, but I figured I could handle chemistry. So I looked at careers that went down that pathway as opposed to maybe engineering careers. When I went to school, I thought, well, maybe I knew I wanted something in healthcare. So I started taking science classes and math classes, and wanted to be a pediatrician. Then I saw how many years it took. Like you can see our surgeon here, how many years it takes to become a pediatrician. And I thought, maybe not. And then, I don't know why, my sophomore year of college, I came home, my mom's a pharmacist, and I never considered it, never even thought about it. And it hit me like a ton of bricks, like, maybe pharmacy. So I looked more into it. I kind of scrambled and got some classes and was able to apply to pharmacy school. Pharmacy school has changed a lot in the 26 years since I went to school. I was able to do 2 years of undergrad, and then pharmacy school back then was 3 years. Now pharmacy school all across the country has changed to 4 years. You get a PharmD. And it depends on what area of the country you're in, how competitive it is to get into pharmacy school. Unfortunately, California and the East Coast are pretty competitive. So you pretty much need a 4-year undergrad degree, and then you apply to pharmacy school, which is a 4-year degree. If you know in high school that you want to become a pharmacist, there are fast-track programs where you can get through in 6 years. So, not a lot of people know what they want to do in high school. I understand that, but there are a few that do. So it can be anywhere from 6 years to 8 years. And then if you want to work in a hospital, sometimes there's a residency that you'll need to do. So it's changed. Why did I choose this profession? Because I like science, so I wanted something in the science, a science-based career. And like many of these others, I wanted to help people. I get a lot of satisfaction knowing that what I've done at the end of the day is help somebody. In this profession, I could support myself and live independently. And something else that I'm really surprised I thought about as a sophomore in college was that maybe I want to do it part-time someday. And so was this a flexible career? Because there are careers out there, some that aren't. Like, I have a friend in LA that's a lawyer. There really isn't a whole lot of part-time lawyer work. So if you think you're going to want a family and maybe want to have the flexibility of part-time work, pharmacy is a great career for that. Is pharmacy in high demand? It is a growing career. They're just like they were talking about. You've probably heard of the baby boomers. They're just a little bit older than I am, and they're living longer with all the technology and the medications and everything we have. So there's going to be a need for pharmacists. They think it'll be growing by 25% until 2020. A typical salary, and like they said, it kind of depends on the cost of living where you live. A typical salary for a pharmacist is about $120,000 a year. It can range from 105 to 140, depending on where you live, but it's enough to support yourself, even in the San Diego area. My normal, well, when most of you think of a pharmacist, you probably think of the person working at Rite Aid or CVS or Costco. There are so many other different jobs in pharmacy. I've always worked at a hospital, and I really love my job because I feel like part of a team. You know, I round with the doctors. We talk about the medications. We talk about the patients. If there's changes that need to be made. Before anybody gets a medication in a hospital, the doctor orders it in the computer. Then I, as the pharmacist, have to look at it next, and I have to decide, okay, is this the right drug for this patient with this disease? Is this the right dose? And are we giving it at the right time? So I have to verify it, and then the nurse has to verify it. She goes through the same process I do. So 3 people have looked at any order before you get a medication, trying to make sure that it's very safe and that you're getting the right medication. So that's basically what my job is. I'm often in the ICU. I sit in front of a computer most of the day and verify orders. I review all the patient's profiles to look at the medications to make sure there's not duplicates or something that looks way out of whack. The fact that I'm at a teaching hospital at the VA, it's connected to the UCSD Medical Center. There's a lot of medical students and interns and residents rotating through there. So I often have to page them and have a discussion about the doses and stuff. And so it's a lot of teamwork, and I really like that aspect of my job. You have to be able to keep calm, because when there's a code blue, kind of like the paramedic talked about, when someone's heart stops or they stop breathing in somewhere in the hospital, we run to that patient's bed and start doing chest compressions and maybe shocking them and giving them medications. So I have to be calm enough to be able to draw up the medications, give them to the doctor, possibly suggest something. And I do actually enjoy going to the code blues. Now that they don't freak me out or anything, it's actually a very good experience with teamwork. What's the least thing I like about my job? I really could not think of anything I don't like about my job. I would do it again in a second. Talking about other jobs in pharmacy, so there's your retail pharmacist who maybe works at the CVS or Rite Aid. There's a hospital or clinical pharmacist like I am. They need pharmacists in academia. When I moved to California 16 years ago, there were 4 schools of pharmacy. Now there's 11. So there's a lot of opportunities to be a teacher as a pharmacist, a compounding pharmacist. Some creams and lotions and solutions are not made by an actual company, and the pharmacist will actually have to compound those and weigh out the powder and mix it into a medium. Critical care pharmacists, the ones that work in ICU, like I sometimes do. A hospice pharmacist, people at the end of their life. There are definitely medications involved. Infectious disease, pediatric, geriatric, nuclear pharmacist, operating room pharmacist, poison control. When I was in Seattle working at Children's Hospital, I did a rotation through poison control, and you take the phone call, and once again you have to kind of stay calm and talk someone through, maybe a child or something ate something they weren't supposed to. Then there's the whole industry, pharmaceutical companies, where they need sales people if you like to travel and if you're good with people and can convince someone to buy anything, you might want to do sales. Research, lots of opportunities in research. Marketing, drug information. Someone has to come up with all the package inserts and all the wording and go through all the liability to write the information about a new drug. Clinical trials. So there's lots of jobs for pharmacists in the industry. Okay. So a couple of my takeaway messages real quick. When you get to college and you decided you want to, you think, okay, engineering or pharmacy, and you start taking your classes, you'll have some classes that you don't love. I don't love chemistry, but I can get through chemistry. I didn't love inorganic or organic chemistry, but as long as you can put the work in, and as long as the other classes you're taking you're interested in, and you know what kind of job there's going to be waiting for you, and you can see the light at the end of the tunnel, keep going. Now, if you don't like 90% of your classes, it might be time to think about switching your career or your major. My son is, he was good at physics and he was good at math in high school. So we said, pick an engineering. There's always going to be a job in engineering. So he picked computer engineering. Went to college, did that for 2 years and just really didn't like the classes he was taking, the majority of the classes he was taking. He really likes physics and he's good at physics. So he's transferred to a different school and he's just studying physics. So if you can also find what you're good at and see the careers that are in that pathway, that's a good thing also. And stay with science if you can. It's a good career and we need more science people out there. Try and figure out if you are the type of person that likes to work alone or you like to work with a team. If you like to work alone, maybe you're good at research. If you like to work with a team, there's lots of opportunities being on a medical team, a pharmaceutical team, any kind of team. So try and find that out about yourself. Talk to people in your family or neighbors that have a job that you might be interested in and see what they really do every day. If you can shadow them, even better. So that you can start eliminating things like, oh, I really can't see myself doing this. I really can't see myself doing that. So even eliminating those things. When you get to college, you know you're not going to take classes in there because you can't see yourself doing that job. So anything you can eliminate now is great. And pick a college that's going to have lots of choices. If you're interested in Chinese and pharmacy and engineering, pick a school that has classes in all of those. But pharmacy is a great career. There are a lot of options in pharmacy that people don't know about, and I'm happy to answer any questions if you have any.
Thank you so much. All right, well, great. We are just a few minutes behind, but I appreciate all of you staying, and I appreciate all of you coming this evening. I'd like to just end the evening just with a quick thank you and a round of applause to our spectacular presenters. And if you would like any one-on-one with them, they are going to just stand up and feel free to ask them any questions. And then at about 10 to 8, we are probably going to close the doors. So you have about 10 minutes if you'd like to. Thank you. Thank you again very much.